Good morning.
Hello,
how are you?
Good morning.
Ms.
Great.
Elena?
Yes.
I'm Dr. Chang. Nice to meet you. All right, terrific. So I'm Dr. Chang again. I'm here with Austin Plastic Surgeon. Just so that you're aware, I'm an internal medicine physician here with the practice, and I help with the skinny shot consults. I usually go over some medical information regarding the semaglutide and tirzepatide medications, but before I start with that, do you have any questions or topics you'd like to address?
I guess something I've been thinking of are what are the main side effects of this medication? I haven't heard much.
Sure, absolutely. Happy to go over all of that with you. So to address your question, some of the most common side effects do include GI-related things. So in particular, nausea, vomiting, diarrhea, constipation. For some people, they can actually develop or have a little bit worsening of heartburn, but it just kind of depends on what your baseline is. And then I would say, less commonly, a little bit of headache and sometimes fatigue. It's important to know that not everybody gets these side effects, and we do kind of give some ideas on how to minimize those potential side effects. But you should just be aware that sometimes they can happen, and if it does, please let us know so that we can help you through it.
Okay, sounds good.
All right, terrific. So to kind of get into a little bit more detail about semaglutide and tirzepatide, first couple of things to know is you may have heard of these medications under different brand names. It's been all over the news, so if you've heard of the names such as Ozempic or Wegovy or Rybelsus, those are different branded versions of semaglutide. And if you've heard of the name Mounjaro or Mounjaro, that's the branded name for tirzepatide. It's important for you as one of our patients to know that we actually get ours from a compound pharmacy, so we get compounded semaglutide and compounded tirzepatide. And as such, we actually do not call ours Ozempic or Wegovy or Rybelsus because we are getting the compounded version. At a high level, these medications, I consider them essentially cousin medications. Semaglutide, from a mechanism standpoint, works on one receptor in the body, that's called the GLP-1 receptor, whereas tirzepatide also works on the GLP-1 receptor, but in addition has a GIP receptor function as well. So that's what I mean by they're a little bit of cousin medications. Tirzepatide is just a little bit more potent, and as such leads to some more efficacy. And into how these medications affect the body, I mentioned about the GLP receptors, the GLP-1 receptor and the GIP receptors. Basically, the semaglutide and tirzepatide both function similarly in the way that they impact you. Both medications do basically help your body to be a little bit more efficient in metabolizing sugar, and that's why still, like the Ozempic version, for example, and Mounjaro are branded for diabetes management. It's because of that property and that effect in the body. For weight loss, there are two main things that happen. I say that one's kind of here in the brain, one's here in the stomach. Up here in the brain, it's really about appetite and craving suppression. And then here in the stomach, there's a property that they both affect called delayed gastric emptying. That's just a medical term or medical way of saying that when you eat and drink, things are kind of moving through a little bit more slowly through your stomach. So that leads to feeling full a little bit faster and feeling full longer. So kind of to sum that up, I just say, this is really a hunger suppression piece. This is a satiety effect. The net effect of all that when you're on these medications is ultimately reduced consumption. Then to go over some strategies to help mitigate some of the potential side effects that we talked about. Definitely tell folks to stay very well hydrated, get plenty of water, and eat a lot of protein. If you're a little bit predisposed to getting some constipation, or if you do get some constipation with the medication, definitely recommend increasing your fiber intake as well. As far as dosing goes, it's very straightforward. We follow the standard dosing that's out there, it's published. We start small, go slow. It is a once-a-week injection. We start you on a dose, have you go for 4 weeks, and then we have you come back and we do a check-in. And we kind of see how things are going. And together, based on how you're doing and how you're feeling, we will decide on your next dose after that. Semaglutide basically has 5 different dose tiers. And tirzepatide has about 6 different dose tiers. I tell people all the time, especially up front, that it's not a race to get to the highest dose. It's just like any other medication in that regard. We just want to take you up to the dose that works for you. Okay. And then the last kind of part that I usually go over is just about general expectations. I do like to tell people up front, because people react a little bit differently just from one person to the next. The first month is really about onboarding onto the medication, making sure that it's safe for you, making sure that you're tolerating and not having too many major side effects. So you may or may not lose weight in the first month, right? And that's okay. I tell that to people up front so that they don't get discouraged after being on the medication. Month 1 is about safety and tolerance. If you happen to lose weight, that's great. That's a bonus. I would say congratulations. But after that, we have a lot of space, as I mentioned, to move with dosing. So looking a little bit further out, a little bit of forecasting and just understanding kind of how this works and what to expect. The clinical trials essentially showed that after 12 months of therapy on the semaglutide, folks were getting around 15% weight loss. And that's a general target. It's not a hard and fast number, but it is a number that you can be thinking about to try to aim for. With the tirzepatide being the more potent of the two medications, folks are getting a little bit over 20%. So that's kind of shows and explains the relative difference between the two medications. And then finally, the last data point from the clinical trials that's pretty important to know is after 5 months of therapy, there's a much lower chance of rebound weight gain. So that addresses sustainability. So you kind of put all that together, and I usually tell folks, you know, number 1, we want to help you get to your goal weight and help you achieve that goal. Number 2, we want to help keep you there, and that's the sustainability part.
Perfect. Thank you so much. You made that so clear.